Hello, this is Dr. Gay from First Look MRI, and this is a patient in their late 40s. They had left hip pain increasing in severity, and we thought maybe they had a labral tear or arthritis or maybe a muscle strain, and so we did an MRI of the hip. I also wondered about maybe a stress fracture, and so we look at their hip and it looks really good. There's no evidence of arthritis, no spurring or erosion. There's no significant joint effusion. We look at the labrum here, it looks like it's intact. The deep muscles look normal. And the finding is here on the outside. So here we have the gluteus muscles. In the very front we have the gluteus minimus, and then the middle part, the intermedius, and then towards the back, the maximus. Well, overlying the intermedius, we see this linear band, which is part of the iliotibial tract. The proximal iliotibial band comes up here, and broad aponeurosis, and it goes all the way down to the lower leg, and attaches on Gerdy's tubercle there below the knee joint and the tibia. Now up high here, it's this broad, thick band overlying the muscles. In the very front, we can't really see it on this view very well, but there's a muscle in the front, which is the tensor fasciolata, and that looked okay. It's right along the anterior margin, just off the field of view. But you can see here how this aponeurosis is poorly defined. There's edema in the overlying subcutaneous fat, and also in these underlying muscles, the superficial fibers are partially torn. So this is a partial tear and the inflammation of the proximal iliotibial band. Now this is a big coronal field of view stir image here, and you can see the right side. It comes up here and attaches up on the iliac spine here. It comes down, nice muscles beneath. On the other side, though, we can see that down here in the midsection, it's ill-defined. It looks like it's almost separated here, like partially torn. If we come up to the very proximal attachment, things look pretty good up high there. And on a repeat stir sequence here, we see things a little bit better. The right side looks normal, and here on the left-hand side, it really stands out. So again, there's the iliotibial band, really poorly defined and partially torn here with the surrounding muscle edema and edema in the subcutaneous soft tissues. And we're going to put up an axial image now to look at the same thing. If we put on our axial sequence, this is starting up as high as we got, but you can see this abnormal signal within the underlying muscle. And then up here in the very, very front, we're catching a little piece of that tensor fasciolata muscle that looked okay. But from here on back, this broad aponeurosis is partially torn and ill-defined. And here it comes back together. And so this is a rare cause of hip pain. I don't believe I've ever seen it up here before. I've seen several down distally, and the iliotibial band friction syndrome down above the knee joint. But up here is a more rare place to get the inflammation and partial tearing and edema. But interesting case of iliotibial band partial tear or friction syndrome up high here. And thank you very much.